neglected by individuals because perhaps we don't take as much seriousness to the issues of hygiene, dental hygiene, as well as perhaps going to the dentist to get yourself checked out to preempt some of the consequences of not taking care of your teeth. And in studio today, I am joined by experts in this area. I have Damaris Odulwa of Kenswe Dental, a clinical officer, as well as Dr. Elizabeth Dimba from the UAN Dental School. Thank you so much, ladies. And I see you've brought us gifts. Perhaps are you planning to teach us a few things about our teeth? I'll start with you, Daktari. I see you have this dental model, right? And one of the areas, I think the most basic, when we are young, we're told about hygiene. You have to brush your teeth after every meal, yeah? Make sure your teeth are clean, your pearly whites, because of course, it's your face, it's how you look, and also there are other health implications. So let's just start from that area of basic taking care of your teeth. Why is it important to take care of your teeth? And then could you demonstrate to us how to take care of your teeth?
Thank you for having us. Now, we are here to talk about health of the mouth and health of the teeth.
Yeah.
And
so that's the two different things.
Yes.
Okay.
Because when we're talking about the teeth, we're talking about these pearly whites, as you have called them, the hard tissues of the mouth, right? And those need to be kept clean because the best way to prevent dental disease is to brush the teeth as frequently as possible. You've mentioned that you were taught to brush the teeth after every meal.
Yes.
And we have a saying that you brush your teeth in the morning to keep your friends, and that's for fresh breath.
Okay.
And then you brush your teeth at night to keep your teeth.
Oh, cool.
Yes. So you don't, so that you don't have to lose teeth due to extractions and gum disease and so on and so forth. So you have spotted our model over here.
Yes.
And we are going to work together with Damaris to do a toothbrushing demonstration, because you could have the correct toothbrush, you could have the correct toothpaste, maybe the technique is not good.
Okay.
So when we are talking about health of the mouth and health of the teeth, the most common diseases that we face are dental decay, what we call dental caries, and also gum disease.
Okay.
And with gum disease, you have a situation where frequently over the age of 50, 60, people are just losing their teeth spontaneously because of diseases of the gum.
Okay.
And then the third problem that we face very commonly in our country is the problem of fluorosis, especially in areas like Kajiado, along the Rift Valley, where you see people are drinking hard water. And that hard water gives you the brownish discoloration of the teeth.
Is it a corrosion or just a color issue?
It's not a corrosion per se, but what happens is that the teeth form with extra fluoride within them, and that extra fluoride makes them form a bit weaker than they otherwise would be. And once you see fluoride in the teeth, it's also in the skeleton.
Okay.
So where we have a lot of fluorosis in the country, we should actually be talking about preventive programs such as defluoridation programs. You bring the fluoride level down, yes, and then you have a healthier outcome.
Wow, that's
like
very
that.
interesting.
Yes.
I've never thought of it that way, and we have a lot of conversations going green and all that, but never hear about, defluorosis, or what have you called
Defluoridation.
it? Defluoridation.
Defluoridation programs,
Wow,
yes.
that's very important and very, very key. But I'd like to cross to you, also, Kenswe Dental. Tell us about Kenswe Dental. What are some of the conditions that you encounter in your line of work, and what are Kenyans neglecting to do that is causing them to actually be victims of dental disease?
Well, thank you. Kenswe Dental is a project under Kenswe Hospital, which is also a project under Kenswe organization.
Right.
And the reason why this unit was set up is to give oral health solutions to our students at Kenswe Secondary School. And one of the major things we focus on as Kenswe Dental Clinic is preventive measures.
Yes.
And before I get onto that, I know that dentistry as a field has really evolved. If there's a field that has transitioned in this 21st century, it's dentistry.
Yeah.
From the ancient Babylonians and the Egyptians, invention of toothbrushes from twigs, to to the French surgeon who is currently known as the father of modern dentistry. But now we have come up with beautiful, artistic, well-furnished dental units.
Yeah.
Where even doctors are dancing on TikTok for their patients.
And it's even gone from dental care to even aesthetics.
Exactly,
Yeah?
exactly. But then at Kenso Dental Clinic, we are looking at, do you just want to go into those well-furnished clinics? How can we prevent or save you from some of the costs that are involved in the procedures that are done in this clinic? So we are a well-furnished clinic, yes, but we focus majorly on preventive measures.
Oh, nice.
The reason is because we deal with children. The pupils at the school, we notice that, just like Dr. Dimba has said, we notice that they are faced with a lot of dental anomalies.
Right.
And one of the reasons why they're getting this thing is because of their oral hygiene. So,
Kids are just not brushing teeth?
well, yes and no, they are brushing, but maybe they are not brushing properly, and some of them are not brushing the right with the right frequency, or not using the right things for brushing. So we are so passionate about preventive dentistry more than curative, and that's why we come up with oral health education programs that we began at our Kenso Secondary School. We have a team called the Oral Health Ambassadors, whom we have equipped with basic skills on what they need to do on brushing, the do's and don'ts, and what they're supposed to use. So this is a model, like this is your mouth.
Yeah.
So how do we brush? One of the things we look at is how do you brush?
Okay.
And what are you using for brushing?
Yes.
And the technique matters a lot. We tell people that it is not about the whatever you use, but it's about the technique.
Okay.
The magic is in the technique. So you need to brush properly. You need to put your brush at least at a 45-degree angle of your tooth. And when we are brushing, we are supposed to brush from the back tooth coming at the front up to the other end.
Okay.
And then you notice that your mouth has, we have 3 sections that we are supposed to brush in our mouth. You're supposed to brush the outer section. You're supposed to brush the chewing surfaces because they have grooves and fissures where foods and sugary foods stick. And you're supposed to brush the inner surfaces. So in the 4 quadrants, you're supposed to take enough time. That's why we talk about have at least 2 minutes of your time just to brush. If you take 30 seconds per quadrant, then that adds up to 2 minutes of your brushing.
Yeah, and it's interesting you mentioned that, because you find a lot of people have healthy teeth on the front side, but then within the grooves we have the black decay marks. So clearly they might be neglecting that area, right?
Yes. So those are the things, some of the things we emphasize. Even for the patients who visit, we take our time and just educate our patients on proper brushing, because it prevents a lot of dental anomalies. Yeah. So when that is it for brushing, and with oral hygiene.
Before you get into your next point, we're going to take a short break. This is very interesting stuff, and I like us to take it slow so that we don't miss anything. We're going to take a short break. When we come back, we'll still have our experts on dental health telling us how we need to be taking care of our teeth, and perhaps what more you can learn about that you haven't been knowing about your teeth and how to care for them.